Throughout this week, we're taking a look at mental health, how it affects those who struggle with it, and various resources that are available to them. Today, our LV Hissam spoke with a psychiatrist, Dr. Elizabeth Collier, to learn more about depression and seasonal affective disorder. LV.
According to the National Alliance on Mental Illness, in 2023, 1 in 5 adults in the U.S. have experienced some type of mental illness. Of those illnesses, depression made up 8% and anxiety disorders made up 19% of prevalence in U.S. adults. But what is depression and how can the change of the seasons affect it? To answer that question, I spoke to a psychiatrist who learned more about depression and seasonal affective disorder. According to Dr. Elizabeth Collier, a psychiatrist with WVU Medicine Camden Clark, depression and seasonal affective disorder, also known as SAD, are very similar to each other.
The symptoms are almost indistinguishable from each other, except that depression can occur within any time of the year. Seasonal affective disorder occurs more often as the seasons change and more commonly in the fall and winter months.
Dr. Collier says that some of the symptoms that are similar between depression and seasonal affective disorder include changes in sleep and appetite. People may also have low energy levels, sad mood, feelings of guilt, worthlessness, and even suicidal thoughts.
The biggest difference there is that with seasonal affective disorder, we tend to see more of an increased appetite, decreased energy, increased needs for sleep, so we're not wanting to get out of bed, we're kind of eating all the time. So that's kind of the biggest difference between the two of them.
Dr. Collier says that the causes of the two illnesses are dependent on a variety of factors. It could be something as simple as an imbalance in brain chemicals, an environmental cause, or a change in medication. It can also be caused by something a bit more nuanced, like a traumatic event, changes in your brain structure as you grow, or even genetics.
Different, medical conditions can cause depression symptoms. So, there's a lot of combination of things that lead to this. For seasonal affective disorder specifically, what we kind of have the understanding of is while the time changes, when the weather changes, we're spending more time indoors, we're less active, we're getting less exposure to sunlight, to that vitamin D, and so, our moods are kind of tending to go down. We're also dealing with increase in stress around the holidays where, we're putting a lot of pressure on ourselves, so those symptoms are popping up more often.
Dr. Collier says that if you or someone you know believes that you may be living with depression or any kind of mental illness, that the first step is to seek medical advice by looking up psychiatrists and nurse practitioners in your area and setting up an appointment.
If you're not able to get in with them though, because sometimes it can take a while, primary care is a great place to start. They're well versed in treating, a number of mental health conditions, and so they're a good bridge between getting in with that psychiatrist.
In the next part of The Silent Battle, we'll take a deeper dive into what may happen during someone's first appointment with a psychiatrist by taking a look at mental health screenings, what goes into them, and what the process looks like after they are completed.